Hello, everyone, and welcome to the Aplastic Anemia and MDS International Foundation continuing podcast series. We're coming to you today thanks to generous support from individuals, donors, and our corporate partners, including Celgene. My name is Alice Hauk, Senior Director of Professional Programs at AAMD-SIF, and we're chatting today with Dr. Ehab Atallah, Professor of Medicine and Section Head of Hematologic Malignancies in the Medical College of Wisconsin Division of Hematology and Oncology. Dr. Atallah specializes in leukemia and myelodysplastic syndromes at Froedtert Hospital in Milwaukee. We'll be asking Dr. Atallah about the results of a study published in the Journal of the American Medical Association Oncology regarding transplantation for MDS. Dr. Atallah, you recently led a study comparing the outcomes of patient age groups in transplantation for MDS. Can you tell us why this study was undertaken by you and your colleagues?
Hello, and thank you for inviting me. So we started the study back in 2010, and prior to 2010, the transplantation coverage for patients with MDS who had Medicare coverage was really dependent on the local coverage determinations. In 2010, CMS issued a national coverage determination about MDS and agreed to cover stem cell transplantation for older patients with MDS if they are enrolled on a clinical study. The CIBMTR, myself, Dr. Rizzo, and Dr. Horowitz submitted a concept to Medicare that we would prospectively collect data on the safety of transplantation for older patients with MDS. And based on that, Medicare agreed to cover transplantation for older patients with what's called coverage with evidence development, which means that patients would enroll on a prospective study. We would collect the data and collect safety information and report back to Medicare on the safety and efficacy of this approach for Medicare patients with myelodysplastic syndrome. So this is why we started the study, is to prospectively collect and evaluate the safety and efficacy of stem cell transplantation in older patients in order that Medicare would cover this procedure.
And you referred to CIBMTR. Can you tell us what that is?
The CIBMTR is the Center for International Bone Marrow Transplant Research. And one of its functions is to collect all the data for transplantations performed in the United States. And that data is used for research, safety, and follow-up of all patients who receive a transplant in the United States.
And what were the key findings of the study that you conducted with your colleagues at CIBMTR?
So really the one-liner, the key finding was that transplantation for older patients older than 65 was safe and effective in this group of patients, and their survival was similar to patients who were aged 55 to younger patients, specifically 55 to 65. The other thing that was very interesting is since the study opened, the number of Medicare patients or patients older than the age of 65 who received a stem cell transplantation almost quadrupled, which indicated that there were many patients out there who were eligible and could receive a transplant, but just did not because of not being able to get this mode of treatment.
What are some of the reasons transplantation is not offered as an option for MDS patients?
So there are many reasons for that. First, as we all know, as we get older, we could get more illnesses. So older patients frequently have comorbidities that exclude them from getting a transplantation. And second is that referring oncologists or physicians don't necessarily know that this is a safe approach for a patient who is, for example, 69 years old. And patients themselves sometimes say, I'm older, I'm not sure I want to go through this process. And lastly, of course, which like I mentioned earlier, just having access to a transplant, not all patients with Medicare had access to stem cell transplantation because of coverage. These are the reasons, or some of the reasons, of why older patients are not referred for transplantation.
And recently there have been improvements in transplantation that has made it more safe and effective for patients. Can you tell us a little bit about what some of those improvements are that make it a better option in some cases for older patients?
So there are many improvements. Perhaps the most important is the ability to perform what's called a reduced intensity transplant. So with a reduced intensity transplant, it involves less intense chemotherapy for conditioning, or less intense chemotherapy prior to a patient receiving bone marrow cells or the transplantation. And being able to do a reduced intensity, we can now safely transplant older patients.
And were there any limitations to the study that you conducted? It certainly had important results for Medicare coverage, but were there issues that arose that you would like to see further study to find out more about some of these things?
I think there were a couple of limitations. First is, like I mentioned, age alone is not a predictor. However, it's really all about how the physical condition or the physical function of the patient, and not age alone. So if someone is older and healthy, then they could undergo this. We do have some markers or indices, what we call the comorbidity index, which measures how functional the patient is or how healthy they are prior to transplantation. However, having other functional measures would also be useful. The second limitation is we didn't have molecular studies. So molecular studies are more refined prognostic indicators that look at the patient's disease and help us to stratify the risk of the disease. And lastly, and I think most importantly, is that we didn't collect data on quality of life for those patients who underwent stem cell transplantation. In other words, yes, it was safe. Yes, patients are able to tolerate it, survive it, be cured from the myelodysplastic syndrome. But what was the improvement in quality of life when they underwent this procedure? That's something we definitely need to look at in the future.
And what are the most important things that MDS patients and their caregivers should understand when considering transplantation?
MDS patients and their caregivers need to understand that, if you're older, you can still be considered for a transplant. However, our study included very few patients above the age of 75. So above the age of 75, we don't really have a lot of data. Second, transplantation is an intense process, and it will affect quality of life for a period of at least 3 months and possibly longer than that. And lastly, that there is a risk associated with this procedure, even up front in the first 100 days, where unfortunately 10 to 20% of patients die from this procedure. So these are all things that need to be considered, thought of, balanced with the possibility for cure and longevity with this procedure, with stem cell transplantation.
And is there anything else you would like to add about transplantation, especially if patients feel as if they are not being given that as an option, even though they feel they may qualify for that? Should they seek a second opinion or ask their physician why they are not being considered for transplantation, or any other options?
I think all patients, most older healthy patients who have myelodysplastic syndrome should be referred to a stem cell transplantation consult, especially patients with high-risk myelodysplastic syndrome. And then what I always tell patients is you don't lose anything by knowing more or learning more about the options. Whether you proceed with it or not, that's completely up to you. But learning more about transplantation is really important. So everyone, especially the patients, would make an educated decision on what they want to do and what are their priorities in life.
Thank you very much, Dr. Atallah. As always, if our listeners need any additional information, you can contact AAMDSIF directly at www.aamds.org or contact us directly via our helpline. And Dr. Atallah, thank you so much for sharing your time and expertise with us.